Here I am going to show you the demonstration of the first yoga module, which is being presented for the management of COVID-19 virus. This is a simpler, easy yoga protocol. In fact, there is a well-defined, structured yoga protocol which is suggested by the Ministry of Ayush, Government of India. There is also a similar, almost similar protocol suggested by the S. Vyasa Yoga University through its research experience for more than 4 decades. What we are showing is sort of a combined version of the Ayush protocol and the S. Vyasa methodologies. And we have made it into simpler and easier graded level into sort of 4 modules, because the need of the participants is quite demanding now, quite challenging now in terms of the health compared to what it was a year back. So based on the discussions that our team had with various medical experts who are dealing with this tough situation of the COVID-19, we have made a simplified version of it, a very easy version of it, and how we should be able to do. So when we say yoga, don't think I have to stand upside down or do all topsy-turvy postures, inversions. No, it is a very easy, simpler module with emphasis more of the breathing and of the relaxation component. The objectives are to enhance the lung capacity and improve the pulmonary functions, and then to make the breathing properly oriented, and also to enhance the immunity. Immunity boosting is very important, and overall to reduce the anxiety which this pandemic is creating on all of us. Let's do the practice so you don't have to sit down on the floor. Many people are complaining about back pain in this season, and knee pains are also increased. So you can sit comfortably in a chair and then do. Young people, those who want to do by standing is also fine. So this I'm going to show you all considering people who are not able to stand, people who are not able to squat down and sit. So that is the idea with which we are presenting this particular video. And it need not be done only by the COVID positive people. COVID positive who are there currently it's going to help, and who are previously COVID positive, so they are post COVID recovery stage. This is going to help them, and preventive for most of us. So don't think that if I do this I'm prevented from this. Nothing like that. Whatever the medical people are suggesting, we have to take their medical advice. Even people who are present COVID positive should take the medical treatment. Along with that, this is an add-on. Definitely it adds a lot of value, but the medical protocol should be followed. Along with that, yoga definitely adds a lot of meaning, a lot of value, and a lot of solace, a lot of benefit. And let us try doing this, my dear friends. So for doing this, there is no criteria. All of us can do. As and when if there is any thing that somebody should not do, I will tell you. But most of these everybody can do. Let's start this with sitting comfortably on the chair. Your hands resting on the thighs, eyes gently closed, palms resting on the thighs. Just mentally relax your whole body and get prepared for the yoga practice. Observe your whole body and talk to your body. Oh my dear body, I am doing this practice for your betterment, for your health, for your calmness. So cooperate and facilitate me to do this in a better way. Slowly shift your awareness to the breathing. Observe your normal natural breathing and talk to your breath. Oh my dear Shvasa, I am doing all these practices for the betterment, for the enhancement of your flow. Please cooperate in making me healthier and healthier. Just observe the slow breathing. Inhale slowly. Exhale slowly. Breathe in. Breathe out. Let's start with 3 Omkara. Take a deep breath. Inhale. Again, take a deep breath. Inhale. Om. After feeling the vibrations of the Omkara in the whole body, let's begin the Prarthana. Hands together in Namaskara Mudra. I shall give a gap after each phrase of the Prarthana. You can repeat after me. Om Sahana Bhavatu Sahanau Bhunaktu Sahaviryankaravavahe Tejasvinavadhitamastu ma vidvishavahe. Om Shanti Shanti Shanti. Let's all work together, nourish ourselves in the right direction. May both the teacher and the thought be protected in the right spiritual direction. May we grow and grow more with vigor, that peace prevail everywhere, that all be healthy and happy. Namaste. Rub your palms, take your palms to the eyes, keep the palms above your eyes, make a cup of your palms and place it above your eyes. Feel the warmness of cosmic energy around your eyes. Open your palm, open your eyes and look into your palm. Namaste. Friends, this whole module will be having a set of breathing exercises and a few loosening exercises and a couple of simple and easier asanas, and then the pranayama, relaxation, and the shanti part. So the first we shall do the breathing practices. These breathing exercises should be done slowly in synchronization with the hand movement. The first practice is hands in and out breathing practice. Stretch your hand forward, palms touching each other, and slowly as you inhale, hands out, breathe in, breathe out, hands in. Again, second time, inhale, slowly bring your hands out, exhale, breathe out and hands in, inhale, do it as slow as possible, feel the stretch of the hands, feel the enhancement of the lungs. Exhale, slowly feel the contraction of the lungs and bring your hands together. Drop your hands down, observe the changes. Eventually you can increase the number of counts to 5 and a little more. The second breathing practice is the hand stretch breathing that we are doing. Interlock your fingers, palms on your chest. Sit straight, and you could also, if you feel a little discomfort, you can just go to the back, lie in relaxed way in the chair, and inhale, stretch your palms out, palm facing outward. Exhale, hands back to the chest. Breathe in, breathe out, breathe in, hands out, breathe in, hands back to the chest, collapse, relax and observe the changes. Let's do this in the next level. Inhale, across the forehead, exhale, back to the chest. If you feel comfortable to do, you can keep your eyes closed and feel the changes inside and stretch your hand and do. If you don't feel comfortable to keep your eyes closed, you can keep it open and then do. So 3 times across the forehead, then inhale above the head, exhale, back to the chest. Inhale above the head, palm facing up the roof, exhale, back again. Breathe in, inhale, hands up, breathe out, back. Relax, hands down, eyes remain closed. Now feel the changes in the body, the upper and middle portion of the body. Feel the changes in the breathing, the slowness of the breath, just the flow. Relax. So after these two simple, easy breathing practices, but very effective breathing practices, let's move on to the loosening exercises, in which the first one today is for the neck, for the Griva Shakti Vikasa. Inhale. Look up, take your neck, stretch neck up, exhale. Chin to chin the neck. Don't do it faster, do it as slow as possible. Inhale, neck up. Exhale, down. Breathe in up. Breathe out, down. Inhale, come to the center. Now exhale and turn your neck to the right. Inhale, center. Exhale, turn to your left. Inhale, center. Breathe out, right. Breathe in, center. Breathe out, left. Breathe in, center. Breathe out, right. Breathe in, center. Breathe out, left. Breathe in, center. So after relaxing, stretching the neck, loosening the neck joints, we come to the shoulders. So there's a very simple, easy rotation of the shoulder movement. So lift your hands up and bring your palm to the back of your shoulders, your fingers touching the shoulder blades. Now elbows up, slowly rotate your elbows and arm in a clockwise direction. 2, 3, 4, 5. So inhale and take your hands up and exhale and bring it down. Now afterwards, anti-clockwise, same way 5 times. Let's do 5. Inhale, hand up. Exhale, hand down. 4, 3, 2, 1. Relax and bring your hands down. Palms resting on the thighs. Eyes closed and observe the changes in your neck, in your shoulders, chest, and all parts of the body. Friends, with this, we completed the initial set of the loosening exercise also. And after that, to relax and observe the changes, and then we can chant Akara. Take a deep breath. Inhale. Feel the vibration, presence, Akara. Slowly relax and come to the position. Again, by sitting on the chair, you can do the next practice. If after 2-3 days, after doing this by sitting in the chair, you feel comfortable, these breathing practices, the loosening, and now the asana, what we are trying, you can stand and do it in the third asana. Okay, so I'll just show you the third asana. If you are comfortable to stand and do, you can do. Otherwise, you can sit in the chair and do. Stand in a relaxed way. Your back straight, hands by the side of the body. Interlock your fingers and inhale and rise your hands up, palm facing the roof. Just stand for just a count of 3. With normal breathing, slow inhalation and slow exhalation. Just to be there and maintaining. And slowly exhale and bring your hands down by the side of the body and relax. Now, same, you could do it by sitting on the chair. In case you are not comfortable to do it by standing, you could do it by sitting on the chair. See, I'm just sitting there. Like last time, the breathing we did, just stretch your hand upward, palm facing the roof, maintain. And slow breath synchronization. Breathe in slowly, breathe out. Exhale, come down. Let's do the Ardha Kati Chakrasana, the lateral arc posture. Gives a very good stretch on the side. Take your right hand up, turn it facing the roof Hands parallel to the shoulder. Inhale, bring it further up. This completes the first count. Then exhale and bend to your left side. Now just maintain there. Keep your elbow straight. If you're comfortable, after 2-3 days of practice, you can do it by standing also. I'm showing you the sitting version. Now after that, inhale and come up. Slowly bring the hand back with exhalation. Turn the palm facing the ground. Exhale and drop your hand back to the thigh legs closed. Feel the changes. Compare the changes between the right and left arms, left shoulders. Inhale. Slowly start doing it on the left side. Palm facing the roof. Inhale. Stretch it up further. Bicep stretching the ear. Push it up. Exhale and lean to your right side. Maintain for 2 to 3 counts with slow and steady breathing. Inhale, bring your hand up. Slowly turn it down. Bring it back to the thighs. Eyes gently closed. Observe the changes. Friends, so we have completed that category of the standing asanas, though we would have done it by sitting on the chair for the health obvious reasons that some people have various complications that they can't stand and do, they can sit and do. But usually these two asanas, Tadasana and Ardha Chakrasana, fall in the standing category. Now in sitting category we have the Marjari Asana, which is the tiger stretch. Now usually by sitting down we would be doing. Now for that you have to sit in Vajrasana and do. I'll also show you the variation in case that you are comfortable enough to sit down, you can do, but your knee should be touching the ground. So maybe for avoiding the pain there in this posture, you could keep a towel below your knee. So this would ease you. So keep your legs apart, hands forward like this, keep your legs apart. And slowly inhale, make a curve on your back, look up, exhale, hunch your back, push your stomach in and forehead down. Don't move your hand and other parts of the body, make a curve on the back, look up, exhale, come down. So keeping this towel below the knee will help. I'll show you sideways also. Then I'm going to keep the towel below my knee. Now this is a bed sheet, so keep your feet apart. Now straight away come to this posture and make a curve on the back. Inhale and look up. Exhale. Hunch your back. Feel the stretch, feel the breathing. Now as you stretch out and looking up, you should push your abdomen out, head up. Exhale. So like this 3 to 5 counts you could do the breathing. Now some of you who cannot even put your knees down even with the support of the bedsheet or towel, the best way is to use a chair. So now you should stand like this, take the support of the chair, take a strong chair and then you should be able to hold it like this, keep your legs apart. Now inhale, make a curve on the back, expand your chest. Shoulders up, look up. You should feel. Exhale. Hold it down. Inhale. Exhale. Breathe in. Breathe out. Relax and slowly come back to sitting posture and observe the changes happening after the practice of the Marjari Asana or the tiger stretch. Now to relax, you could chant the Okara, take a deep breath. Inhale and as we exhale, Okara. Feel the vibrations of Okara. Relax slowly. Now we move on to the next set of practices which you're going to do by lying down in the prone posture, which is Makarasana. And in this particular period of the pandemic, the COVID. So Makarasana and Sashankasana in proning seems to be very beneficial. So I'm going to show you from this front and also maybe side I'll show you. So when you lie down in Makarasana, you could keep a pillow. The pillow would help. If you require below your tummy also, you can keep a towel, and this will help you for the nice breathing. And oxygen generation is also facilitated in terms of the less supply of oxygen, your lung congestion and all when it happens in the COVID positive case. So this is helping a lot. So even in hospitals in the bed, they are making the doctors are advising patients to lie down like this. So keep the pillow, the chest on the pillow. You can cross your hands like this and keep there. Keep your toes apart, feet apart, and you need to fill in the air through the nostril, and as air goes in, push your tummy out, tummy down to the ground. Pull your stomach in and exhale through the nostril. For some people, exhaling through the mouth could be ease. That could be a comfort. That could be a better breathing. So I'll show you both. So you have to find out what suits you. And sometimes the doctors would advise specifically that you do this by the breathing out to the mouth. So that time you should do it strictly like that. Inhale, pushing the stomach down the ground. Exhale, pull your stomach in. Breathe in. Like this you could do, which I have shown you for say 3 counts. You can increase depending upon the need, 5 counts, and then slowly 9 counts, like this. Keep increasing as per the need. There are critical conditions, I should not use the word patient, we usually call them as participant in yoga, but in case of the hospital condition, so the patients would be asked to do this repeatedly for a long time, that they are comfortably able to sleep in the prone than even the supine. So next is the same, you can do it with this Sashankasana. Bring your legs folded and again stretch your hand forward. So this is going to be helpful for a few people. So you have to find out by doing what it helps, and if you have doubts, you can call us and ask, we will tell you. So when you're doing this Sashankasana, so you can keep again towel below your knee. So in case you have a knee pain and also you don't have to do, you can stretch and lie. If that is not the case, then you can lie like this, and you can take the support of the pillow and lie down and breathe in through the nose and breathe out through the mouth. You can keep the hands like this. Some people within this, this could be at ease. So we have seen people, so some people like this doing is helpful for some people. So with the help of the caregivers whom you have with you, so you can choose which facilitates your breathing better and relaxing it. So one more added practice for the prone is the Bhujangasana. I shall show you by lying down this way. Slowly you can lie down on the tummy, on the abdomen, and keep your legs together, toes pointing out. Bring both the palms to the side of the chest, chin touching the ground. Now inhale, come up, expand the chest, shoulders, full breathing, hands only up to the elbow. Exhale, come down. Inhale. Exhale. Breathe in out. Breathe out and relax. You can do, depending upon the ease, the comfort that you get, you could do even 5 rounds. Relaxing. Makarasana. Some people relaxing with the one leg folded like this. Matsya Kridasana. This will also help. Relax. Slowly turn around on your back, on the supine. So slowly from the right side I am turning around and lying down like this. So again, completely stretching the leg could be comfortable for some people. If you have back pain and all and you are not able to stretch completely, so you could keep the legs folded at the knee and lie down in the supine. So the first practice in the supine we are going to do is the alternate leg rise breathing. So if you are in case you have stretched the full leg completely, so keep the palms by the side and inhale and stretch your right leg up as much as you could do. Exhale, bring down. Inhale, left leg up as much as you could do without bending the knee. Exhale, down. So alternating 3 times we should do. Now, people who have severe back pain or something could also keep the leg folded and then try doing this hands to the side of the body with the support of the palms. Inhale, exhale. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Relax. Subtle changes. And for some people to lift properly, to do this, so you could also use a belt like this or a simple dupatta or a kapda. So you can, without that, if you keep the leg folded and do as I told you, that is good enough. In case that for some people you are otherwise normal without much back and everything, but you are not able to lift it up, so use such a don't use your leather belts, special belt for yoga if it is there with you. Otherwise you can use a kapda, a dupatta, something like that you have at home. So see, inhale, exhale. Now the other leg. Breathe in left, breathe out down. Breathe in right, breathe out down. Breathe in left, breathe out down. So like this, alternatively, some 3 to 5 counts you could do and relax. To relax again, you could keep the legs folded, hands to the side. If you want, you can keep below the back also to ease your lying down. You could keep the bed sheet below here, lower back also. It all depends from person to person, the need may vary. So accordingly you choose what it comforts. Don't hesitate to take the necessary comfort which is required for you when you practice. So after this we need to go for the next practice, which is Pavana Muktasana, which is again very important. Many people are finding difficult with the digestion and again the back. So for many the gastric problem also arises with the other medication that you take. So this is going to help a lot. So hands by the side of the body, legs stretched straight. So if possible you can keep the hands stretched up, otherwise it could be down here. Inhale and lift your right leg up. Fold your right leg at the knee. Take your hands and interlock the fingers across the right knee and lift your left leg up. Just be there for 3 to 5 counts. Feel the compression on the abdomen. Feel the fold at the knee. Feel the stretch of the left leg. Just observe all these changes and slowly bring it down. Bring your hands down and right leg down. Similarly, slowly lift your left leg up. Bend it at the knee. Bring your hands across the knees. Interlock the fingers. Feel the pressure on the abdomen, the thighs. Inhale and lift your right leg up and maintain for 3 counts. Feel the stretch. Normal breathing. Inhale slowly and exhale slowly. Bring the right leg down. Stretch your left leg up and bring it down. Hands down to the side of the body. Then the proper variation of Pavana Muktasana is to bring your chin touching the knee. So we are avoiding this. So many people have got some discomfort in doing this in the extreme COVID positive cases. So, but Pavana Muktasana, however, is helping them a lot in terms of especially improving the digestion and reduction of the gastric disorder. Now again observing the whole body, we will do a small relaxation technique. It's called the quick relaxation technique, which is to relax the whole body and the mind. Now bring your complete awareness to the whole body, observe the whole body. Bring the awareness to your abdominal region. Observe that your abdomen bulges up and shrinks in. Inhale. Exhale. So this is normal movement of the abdomen. Now synchronize the abdominal movement with the breathing. Inhale. Abdomen up. Exhale. Breathe in. Relax. After synchronizing the breath with the abdominal movement and energizing, feel the relaxation throughout the body, the energy throughout the body. To further enhance Headstand Akara, take a deep breath. Relax. So after feeling the resonance of the Akara, relaxing, slowly sensitize your toes, sensitize your fingers, move your neck to the left and right, bring your legs together, take your right hand above the head, left palm on the abdomen, bend your left leg at the knee, turn towards the right side, palms touching the ground, stretch your leg, feel the linear awareness on the right side, and slowly come up to sitting posture. If you are comfortable to sit in Sukhasana like this on the ground, means upon the yoga mat in case, so you could sit like this in Sukhasana or Padmasana, Ardha Padmasana, whatever you are comfortable to sit down. So avoid sitting in Vajrasana, and let us take the chair and also sit in the chair. Those who cannot sit down, so you should be able to sit on the chair and then do the pranayama, which we are continuing. So this is the most essential part of this COVID-19 management. Those what we did also equally important to prepare the body in various ways. And now to go into the more into deeper aspects of the breath and also the vital life force energy called the prana. So we are doing the pranayama. In this, the first thing we need to understand, friends, are we having the right way of breathing? Are we following the right way of breathing? How do you know? Put your palm on your tummy, right palm on the tummy, eyes closed. Now inhale, exhale. Breathe in, breathe out. Breathe in, breathe out. Relax. So this will tell you that in case when you inhaled, what happened to the tummy? You should tell me now. Most of you are telling that your tummy went inside with the inhalation and tummy bloated out with exhalation. That means the breathing pattern that naturally we have inherited so far is quite different, it's wrong. The right way of breathing should be inhale, abdomen bulging out, exhale, abdomen going in, breathe in, breathe out. So every time this is how it should happen, but for people when I spontaneously told you to keep the palm on the abdomen and then observe, for many people the abdomen went in with inhalation, the pattern of breathing has been wrong. So we need to consciously correct it. I tell you why it is, because we know that there is no direct connection between the tummy and the breathing, but it is actually the lungs and the breathing. So when you inhale, the oxygen supply goes deep into the lungs, into the lobes of the lungs, and then it pushes out, there is a part below the lung called the diaphragm. So when lung expands with inhalation, lung expands and the diaphragm contracts, which pushes out the abdomen. So abdomen bulges out. And with exhalation, the lung contracts and the diaphragm expands and pulls the abdomen in. So this is the connection. Therefore, diaphragmatic breathing is very important for a normal, healthy life. Even otherwise, normally, even in this critical time, it helps us a lot. And therefore, we should consider a relaxed way with eyes closed. Inhale, abdomen bulging out. Exhale, pull your stomach in. Breathe in. Breathe out. Relax. And observe the changes. I did show for only 3 times. You could do as much as 9 rounds of this particular breathing. The abdominal breathing. Yeah, there are ways of doing this with the mudra that we will later see. But now the emphasis is only on the abdominal movement, synchronizing with the breathing. And then next is the thoracic breathing with the lungs, with expansion and contraction, with which we are going to do. So inhale, expand your chest. Exhale. Breathe in. Breathe out. Breathe in. Breathe out. Relax. Again, same. You could do 5, 9, as much as you feel comfortable. Do some in the morning, in the evening. Now we'll go with the shoulders. The clavicular breathing means the upper lobes of the lungs getting expanded, but physically indicated outside through the shoulders going up and coming down. Inhale. Exhale. Breathe in. Breathe out. We also breathe out through the nose, the mouth. Inhale. Like this. So breathing in through the nose and breathing out through the nose could be comfortable and beneficial. Some people, some extreme conditions, so breathing out through the nose, breathing in through the nose and breathing out through the mouth will be beneficial. You need to gauge what suits you. The same set of practice, all these we combine together and then do the full deep breathing. Hand could be relaxed in a complete manner. Maybe you can relax a bit in the back. Observe the changes. Now inhale, bulge your abdomen out. Expand the chest and shoulders up. Exhale, relax your abdomen, chest and shoulders. Inhale, bulge your abdomen out, expand the chest and shoulders up. Exhale. So, the full deep breathing also you could do number of times depending upon the need and availability of the time. It will help you a lot. The whole set, in fact, the Ayush protocol suggests a 15-minute relaxation in the evening, wherein these breathing practices of the abdominal breathing, the clavicular breathing, the thoracic breathing, the chest breathing, and the clavicular breathing, the shoulder level, all these 3 combined together, and then 3 combined together, the deep breathing put together is helping people to relax a lot. So this has the lung capacity enhancement also as a function, fresh oxygen supply also as a function, and also relaxation component is very much there. The same set of practice could be done by lying down. I shall just show you by lying down in Shavasana. Maybe 1 round I'll show, but you could do repeated rounds by lying down in the supine posture. You could again, depending upon your health and need and the demand, keep it folded at the knee or stretched. Now try to keep your hands, both the hands above the head. Now inhale, bulge your abdomen up, exhale.
in out, breathe out, inhale, relax. Now observe the chest portion, the lung portion, and then we do the breathing there, the thoracic breathing. Inhale, exhale, breathe in, breathe out, inhale, exhale. After this, we will go to the next practice. Now we will do with the clavicular breathing on the shoulder level. You can just raise your shoulders up, inhale, exhale, inhale, exhale, breathe in, breathe out. Now full deep breathing. Again, maybe you can keep your hands down or up depending upon your comfort level. Do inhale, punch your abdomen up, expand the chest and shoulders up. Exhale, reverse. Inhale, breathe in, relax. So the same set of breathing practice, that sectional breathing, which we did by sitting on the chair or sitting on the floor, would be done by sitting down, lying down on the mat as well. Nadi Shuddhi Pranayama. I'll show you by sitting down on the mat, but you could also sit on the chair. Do not strain yourself. The breathing is more important here and not how you sit. So you could sit like this, or you could sit on the chair and do it as well. Now sit straight, sit comfortably. This is Nasika Mudra. The last two fingers are open, the middle two fingers closed, and thumb. So you need to bring this and close both the nostrils, the left palm resting on the thigh. You can keep it opened also to receive more energy, or you can keep it closed to conserve the energy. And exhale to the left. Slow exhalation to the left and slow inhalation to the left nostril. Close your left nostril, open your right. Exhale right. Breathe in right. Breathe out left. Breathe in left. Breathe out right. Breathe in right. Breathe out left. Continue for one more round. As you inhale, feel that all positivities, the confidence, wellness, immunity, resistance, happiness, harmony are coming in. As you exhale, feel that all the negativities, fear, anxiety, depression, ill health, and lack of immunity, all are going out of the system. Left exhalation, conclude. Stop the practice, bring your hands down. Now open your eyes and observe the changes, what happens. Friends, this Nadi Shuddhi Pranayama. Nadi is the channel to carry the pranic energy all around the body, and it cleanses, this practice cleanses the Nadi. So if once it's cleansed, then the oxygen supply becomes enhanced all over the body. Blood supply even will be facilitated. The pranic energy distribution is happening in a smoother way. And this is an ATP. What is ATP? Anytime pranayama. So do it as much as possible in the morning, do it as much as possible, even in the mid-noon before your lunch, in a relaxed way you can do. And in the evening again, do it in the Sandhya, and even before going to bed, you go and do in a very relaxed way. You will have the whole day to carry. In case you have any fever, headache, or any such symptoms, Nadi Shuddhi Pranayama will take care, help a lot, and also it will prevent you from getting the common cold and cough, which are quite symptoms people are getting now. So do it as much as possible and feel the positive energy, not the COVID positive. That should not be felt. The positive energy should be felt, relaxation should be felt. This is Nadi Shuddhi Pranayama or Nadi Shodhana Pranayama. And now we have the last for today's practice, which is the Brahmari Pranayama. Recently, a lot of research studies have proved that the nitric oxide is antiviral, antifungal. And how it could be produced in a natural way, but in a special condition when the nitric oxide generation is not happening naturally. So the humming sounds can also produce that. There are abroad in Canada and in UK, they are using nasal spray to produce this nitric oxide for people in need, especially this Corona-19 pandemic. But instead of that, research studies also show that humming sound generates nitric oxide, which is required in the nasal tract. So this makes it as an antiviral and protect you from getting the viral infection. So how do we do it? So the Brahmari Pranayama, which is a wonderful resonance sound, which a wonderful humming effect, is producing this, is the wonderful result that we are seeing with many participants. Let us try to do it also, my dear friends. So how do we do? You need to take the tip of the tongue to the upper palate. Keep your mouth closed. Inhale through both nostrils, and while you exhale, you're going to produce the humming sound of a bee. That's why it's called Brahmari. Right? The humming sound resembles like the Makara. According to some schools of yoga, it is a Nakara because you have folded the tongue inward, so you will not be able to properly touch the lips. So it is sound. Let's try to do it. Inhale. Feel the vibrations of the Brahmari. Now we're going to do 2 more rounds. Take a deep breath. Inhale. Inhale. Exhale. In third round, inhale. Feel the vibration, the resonance of the Brahmari in your head region. The same could be practiced with the Shanmukhi Mudra. There are 2-3 variations of the Shanmukhi Mudra. Today we will do the simpler, easy is to keep the thumb and close your ear lobe so that the feedback, the sound resonance could be felt better. So let's take the thumb and close. Some schools will tell you to close the earlobes with the index finger like this. However, whichever will help you to close. In case, in fact, for people who have pain on your, say, shoulders and arms, you could as well use a cloth to tie it around with the eyes and ears, and then don't tie the nose. I said only the eyes and ears so that you feel the resonance better. And this is like a pratyahara. The control of all our sense organs is very much required, my dear friends. In this pandemic, we have to be inside the house. We should not go out. Restrain from what we should not eat and eat only the healthy food. We should not talk to others. We should not, not talk to others in the sense, go out like as we were doing before and then mingle with people. Social distancing should be maintained, everything. So, pratyahara, the control of the sense organs is very important. People who complain of loss of sense of smell, people who complain of the loss of sense of the odor, the smell and then the taste. This will improve it, my dear friends, through the continuous practice of Brahmari. So we'll do one round. I'll show you how we do it with the earlobes closed with the thumb. Inhale. Hands down. Feel the resonance of vibration. Relax. Now continue the energy and the resonance that you created to do the meditation with eyes closed. We'll do a Sankalpa Dhyana. Observe the whole body. Feel the relaxation of the whole body. Observe your normal natural breathing process. Slow inhalation and slower exhalation. Slowly feel the calmness of mind. Feel that you have done all the good yogic practices, the breathing practices, the loosening stretches, the asana, the relaxation, the pranayama for your better health. Say to yourself, I am healthy. I am healthy. Say to yourself, I am stronger, my immune is better. Say to yourself, my family, my kith and kin surroundings are all in a safer place. And have this positive affirmation again and again, that I am healthy, my family is healthy, I am happy, all the world is peaceful. To give you a balanced, tranquil state of mind. Sense of well-being, relaxation. Let's chant the Shanti Mantra. Hands together, Namaskar Mantra. Om Sarve Bhavantu Sukhinaha. Sarve Santu Niramaya. Sarve Bhadrani Pashyantu. Ma kaschid dukhabhag bhavet. Om Shanti Shanti Shanti. Rub your palms. Palm to your eyes. Feel the warmth around your eyes. To your forehead, shoulders and arms, thighs and knees. Rub your palm. Open your palm like a book in front of your eyes. Open your eyes with a few blinks and a beautiful smile in your face. And look into your palm. Karadarshanam. Have your hands down. And with a smiling face, relaxed way, we'll try to do a kind of a laughter hasyasana with Simha Mudra. Right? Laughter is a wonderful medicine, my dear friends. Yeah, I know. One side, the world is crying with the pandemic. We are losing our own near and dear one. So you can ask, why do you laugh, right? But we need to take care of our health in a relaxed way. So Samatvam Yoga Uchyate is what Sri Krishna tells in the Gita. So let us take things what happening all as the prasadha and pray to God. God, give me the strength to or the courage to change the things I can change. Give me the will to change the things I can change. Give me the strength to accept things I can't change. Give me the strength to accept I can't change. So with this note of attitude, we need to take ahead life for some time, and let's conclude with the Simha Garjana, the Simha Mudra. Bring your hands like this, closed, hands near the shoulders. Now, when I say 1, 2, 3, you're going to take the Narsimha Avatara and throw away Corona. Inhale, 1, 2, 3. Tongue out, you're exhaling out through the mouth. And one more time, inhale. Thank you, my dear friends, for joining with me in doing these simple techniques of the yogic load, and these are going to help us a long way, and very easy, very simple practice are there, everybody can do, right? So this is the ABCD yoga. What is ABCD yoga? Anybody can do yoga. There is no compulsion that you have to stand and do. You can sit in down, and that also not on the floor. You can sit in the comfort of your chair and do. You can lie down with ease with the support of the pillow, with the towel, with the belt. It all will help, my dear friends. Don't worry, yoga is there. Yoga Roga Nivaranam.